let's briefly discuss conjunctivitis. Conjunctivitis is inflammation of the bulbar and the palpebral conjunctiva, also the transparent mucosal tissue that lines the eye and the inner surface of the eyelid. Epidemiologically, it's about 70% of patients with acute conjunctivitis visit a primary care provider for treatment. It's sometimes referred to as pink eye. Etiologies can include bacteria, viruses, allergy, atopy, or toxic exposure. 70% of conjunctivitis is viral, with the causative agent being adenovirus. Second most common cause is bacterial, and however, bacterial is mostly seen in peds. Can be caused by the herpes virus or molluscum. Most common cause of non-infectious is allergies. 15% of all eye-related complaints in primary care. So we see it commonly and need to be familiar and be able to differentiate between the types and the treatments and management. The pathogenesis depends on what type it is, but viral is spread by direct contact or close proximity to the infected person. It is highly contagious, just like bacterial. Bacterial is usually hand-to-eye contact or a self-infection from your own sinus or infected nasal cavities. Allergic conjunctivitis is often associated with hay fever, and it's caused by environmental allergies. I think ragweed's another big one. Perennial conjunctivitis comes from household chemical or pet dander, and acute allergic conjunctivitis is usually immunoglobulin E mast cell mediated hypersensitivity. Vernal conjunctivitis and atopic are chronic and tend to be more severe. And conjunctivitis from long-term medication use, eye drops, greater than 1 month is often seen. Diagnostics, management, and treatment include viral is usually a self-limited disease, about 5 to 14 days. Artificial tears and cool compresses will treat symptoms. Educate the patient about the contagious nature, especially while they're tearing, or at least 1 week after the symptoms begin. And if it doesn't resolve, they really need to follow up in 1 to 4 weeks. Bacterial conjunctivitis, topical antibiotics are not always necessary. Some advocate delayed treatment, and some research advocate treatment related to contagious nature. But one thing is clear: all high-risk patients should always get a topical antibiotic. The book suggests try methoprim or fluoroquinolone drops 4 times a day for 1 week. One of the pearls I'd like to add is that when you teach your patient and you prescribe and teach your patient about eye drops, remind them to keep their eyes closed for approximately 4 minutes after installation, so they'll do what they need to do. Acute allergic conjunctivitis, really we want to try to eliminate the allergens. Sometimes an oral antihistamine might help the itching. Artificial tears, cool compresses, and removing contact lens and not putting them back in until resolution of symptomology. Vernal and atopic conjunctivitis, the treatment and management is similar to acute allergic conjunctivitis. Might use a mast cell stabilizer because of the chronicity of these. Medication toxicity, of course, eliminate the medication, but usually they also require symptomatic relief with something like artificial tears. Referrals, this is really important. Any concern for sight-threatening disease, you refer the patient immediately to an ophthalmologist. Some of the clues might be someone who's had eye trauma, ocular surgery, uses contact lens, the patient with conjunctivitis that also has nausea and vomiting, which do not go along with conjunctivitis. You must consider acute glaucoma. And some of the other things that would just prompt an evaluation is vision loss, pain, severe purulent discharge, corneal involvement, no response or worsening symptoms despite treatment, and recurrent episodes. So finally, in patient education, health promotion education is key, especially related to the disease and what it means and the implications and the complications also. Transmission of disease needs to be discussed, hand washing, changing their pillowcase, washing their glasses, removing their contact lenses. And I think we have to also remember that healthcare facilities the research shows we can transfer conjunctivitis to other patients. So we really need to make a concerted effort to reduce those risks.